Well, thank you very much for tuning in today. This is Jim the Bus Driver, or as I'm known recently and in most of my books, Bipolar Dad. I'll tell you more about why I'm being called Bipolar Dad, but that's a story that I've carried all my life. We are under assault in Minnesota. I don't currently live in Minnesota, but I was born and raised in Minnesota. Half my life in the North State and half my life a little south in Iowa. What's going on in Minnesota is a tragedy. It's going to take a long time to sort it out and to get it to stop. There's an interesting article that I saved from a while back, and the reason I saved it was because it was about a jail administrator in northern Minnesota, and that's Cass County. That's one of the biggest counties in Minnesota, and that's something I'm very familiar with because my parents moved up to Walker, Minnesota, which is the county seat of Cass County, and it's on the south shore of the third largest lake in Minnesota. It's called Leech Lake, and thousands of people from all over come to fish and vacation and have fun summertime events in the Leech Lake area. It's got over 400 miles of shoreline, so I mean it's a huge lake, and there's a lot of little hotels, little cabins, little bed and breakfasts tucked into all the nooks and crannies, and it is really a treat. If you've ever been to Leech Lake, make that a stop, and you will enjoy it. The best walleye in the world. Well, this article was written and posted in the Minneapolis Star and Tribune, and the article is entitled, "The Longer We Wait, the More People Will Die." The legislature should seize the opportunity to pass legislation to help those whose lives have been upended by the opioid epidemic. Serving as the jail administrator in northern Minnesota's Cass County has put Chris Thompson on the front lines of the nation's opioid epidemic. The experience has had a profound impact on him. Thompson is now a lieutenant. He started with the Cass County Sheriff's Office in 1997, moving to jail management in 2016. He's seen firsthand how many people now under his responsibility struggle with substance abuse disorder. Upwards of 65% at his facility, which was built to house 60 inmates and boards about 40 others elsewhere. One of the inmates affected, one of Thompson's former schoolmates, who later succumbed to this disease. Thompson's also seen how wretched withdrawal can be, particularly for fentanyl users. He describes it as having the flu, COVID, and food poisoning all at once, and then multiply that by 5 or 10. Before his jail management role, Thompson said he had a typical lock 'em up and throw away the key attitude. Now he's an eloquent advocate for a sensible new proposal from Governor Tim Walz's administration to improve substance abuse treatment for inmates nearing release. If thoughtfully implemented and utilized, the new program would allow counties to offer increased health care, chemical, and mental health treatment, and reentry services to those who need it, without exhausting local county funds. Releasing healthier people back into the community with resources and medications they need will lead to higher success rates, fewer overdose deaths, fewer emergency room visits with withdrawal and overdose, and lower recidivism. That's always a tough word, but that means keep coming back, keep going back. For Minnesota legislators, whose approval is both needed and merited to launch this pilot program, Thompson noted that substance abuse affects families on both sides of the political aisle. The longer we wait, the more people will die. Put the betterment of our communities first and foremost. Do the right thing for the right reason. It's hard to top Thompson's argument for the proposal, which is often referred to by an ungainly name, the 1115 Reentry Medicaid Waiver. The Minneapolis Star-Tribune editorial board would like to add its strong support for this compassionate, innovative effort to combat the opioid epidemic in Minnesota. The 1115 Reentry Medicaid Waiver. The only addition that they would like to make is to point out that the program would also draw down substantial federal dollars to cover its costs. The new program would be under the umbrella of the nation's Medicaid program, which provides free or low-cost medical coverage to the needy and is jointly funded by state and federal governments. If implemented, the waiver proposal would allow Medicaid to pay for a set of services up to 90 days prior to an inmate's release, including access to medicines for opioid use disorder and care coordination, giving that individual a strong foundation to transition from recovery ecosystem. That's according to information provided by the Waltz administration. Currently, a lamentable and long-standing federal policy known as the Medicaid Inmate Exclusion Policy prevents this critical safety net program from covering inmates' care in public institutions. That shifts these costs to other levels of government, particularly to counties that may struggle in areas with smaller tax bases to provide substance abuse medications, which have a vital role in preventing relapse. A 2021 study by Minnesota Management and Budget found that less than half of all jails in Minnesota provide access to these medications. Let me repeat that. The study found that less than half of all jails in Minnesota provide access to these medications. Fortunately, federal officials also have flexibility in administering the program, and do so by approving waivers to expand coverage and provide the resources to do so. With overdose deaths hitting a grim new national record, The national government is encouraging states to apply for a 1115 waiver to improve treatment for inmates immediately prior to their release. It's a smart public health strategy because so many people incarcerated struggle with this disease and are high risk of overdosing after a period of sobriety while behind bars. The generous financial assistance provided by the feds for this provides further incentive to act. Many of the capacity building and administrative dollars in this proposal come from a 90-10 federal match, making this a powerful lever to improve the infrastructure of Minnesota's carceral institutions. Jeremy Drucker, the state's first director of the new Office of Addiction and Recovery, wrote in a letter to the Minnesota Senate Healthcare leadership, "Those federal dollars would keep a welcome lid on state costs for the program, which are projected to be $6.5 million in 2024 and 25, and then $12.6 million for the second biennium." It's unfortunate that Drucker's letter had to be sent. Legislation to launch the program has made satisfactory progress in the State House, but as of last month, was not included in the Senate's Human Services Omnibus Bill, a key step for ultimate approval. That's an oversight that Senator John Hoffman, DFL from Champlin and chair of that chamber's Human Services Committee, should remedy swiftly. The waiver program has support from Minnesota counties and law enforcement around the state, with Hennepin County Sheriff Dewana Witt a prominent advocate. Information provided by her office notes that Hennepin County has provided medically assisted treatment and medications for opioid use disorder for several years. Witt's office also pointed to a national study showing that inmates with access to this treatment were significantly less likely to be re-incarcerated after 5 years. Witt, in an interview, sounded the same call to compassion as Cass County's Thompson. She urged legislators to approve the 1115 waiver program, saying that this is a chance to lead with humanity. That's a plea that should be heeded in the coming sessions. Law enforcement officials have ramped up their game to crack down on illegal behavior. Some agencies are using pickup trucks outfitted with cameras to give them a higher vantage point from which to peer into vehicles and catch drivers in the act. St. Paul police stopped 2 drivers twice in the same day for the infraction that comes with a $120 fine for the first offense and more than $300 for subsequent offenses. I'm just saying that we have got some serious problems no matter what direction we look. Drug overdose, drug abuse, it's running rampant in all 50 states. We need to do something about it. My name is Jim Stordahl. I use the hashtag Jim the Bus Driver, and I am also hashtag Bipolar Dad. I've got a website that has a lot more to say. It shows what I've been doing, where I've been going, what I look like, what I sound like. That website is www.jamesstordal.com. And you can also send me an email. at storedall.james@gmail.com. Let's keep in touch. You all have a good day.